Welcome back, friends, to TV5 News at 9. And it's time now for Medical Moments with Covenant Healthcare. Joining us this morning is nurse Barb Blakey. How are you, Barb?
Good morning, Colette. I'm great. Thanks for having me this morning.
Of course. We're so delighted that you're here. Okay, so today we are talking about getting the right medical care at the right place and the right time. So it's all about being right today.
Correct.
So as a nurse, you want to make sure that people get the right care for the right health issue. So can you tell us a little bit about the differences between the levels of care that Covenant offers, from primary care to the emergency care center?
Sure thing. Your primary care physician is really the person that always sees the biggest picture.
Okay.
That's the person that oversees your medications, knows your medical history, a lot of times knows your family's medical history. They coordinate care with specialty offices and specialists and make sure that there's no medication interactions and that everything looks good. They're doing your lab work, doing your annual physical, things like that. The urgent care is the place that you go when you can't get into your family physician, but you're not quite sick enough to go to the emergency room. Think of us as your family doctor on steroids.
Oh, I love that.
Yeah, we can do some additional tests, like we have x-ray in the building, but that lab work that you need right away, some advanced imaging and things like that, not usually the urgent care's place.
Okay.
That's our friends down the road at the emergency care center. So the emergency care center is where you're going to go for serious life-threatening conditions, extreme pain, things that truly can't wait.
Okay, so like my baby actually had a reaction to peanut allergy, so we went to ER, and then when I sprained my foot in the garage, I went to MedExpress.
Yep.
So when someone's family doctor is not available and it's truly urgent, Covenant offers MedExpress, and that's what I went to. Can you tell us some of the common health issues that your team actually treats at the 5 locations?
Yeah, so you had a perfect one with that hurt foot. So we do the strains and sprains. We see the patients who are like, oh shoot, it's 9 o'clock on Saturday morning and I think my kid has strep throat. Or it's right before school starts and we've got a fever, we've got to make sure that everything checks out.
Yeah.
We're the place that we're going for those lesser acuity places. We see a lot of rashes. We can do some minor stitches and things like that. So when you cut yourself doing dishes, things like that, we're the right place to go for that. In the summertime, we see an awful lot of people who do those minor lacerations or cuts. In the wintertime, we see an awful lot of people with slips and falls. So we're just that in-between place from primary care to the emergency room.
Thank you for breaking that down. That's really helpful. So what are some of the common health issues? And I love this because I've done this too. Virtual care.
Right, right. So virtual care is your urgent care, but kind of a more pared down thing.
Okay.
I tell people that it's the thing that's kind of a slam dunk. 2 out of 3 of your kids have strep throat. The third one now has a temperature and says they have a sore throat. You think you see white spots back there. That's an urgent care visit. Wow. You know you're allergic to poison ivy. You were out in the woods like picking up sticks or clearing brush, and now you've got this rash. As long as that rash is someplace where you wouldn't be afraid to show your neighbor, so you can get it on camera, then that's a virtual urgent care visit. Because it is a virtual visit, like a FaceTime visit with the doctor. If it's something where we have to do additional tests or you're gonna need an x-ray, not really a virtual visit appropriate, but you can always make that appointment and we can help direct you.
And I love it because if you're at home with the other 2 sick kids, you don't have to leave home because of the third one.
Yep.
Okay, perfect. I love that. So the emergency care center and 911 are always options for emergencies. So what are some of the symptoms that people should really consider when using the ER? Right.
So the ER is there for you 24/7. And just remember, anything that's a serious life-threatening condition, anytime you're thinking it's chest pain, am I having a heart attack? Am I having a stroke? Or is my mom having a stroke? That's a 911 emergency care center type visit. If you're short of breath to the point that you're working really hard for breathing, or if you've got, like you said, a little one who has this new allergy, you know there's hives all over, they're wheezing, you don't know what to do for that, that's a 911 ER type visit. They're there for you when seconds count. They're there for you when you need testing, you need imaging like right now.
Okay, so that makes it plain and simple for us. If it's not a true emergency, but people aren't really sure where to go, Covenant has a place to help people navigate, and it's called Covenant Care Connect?
Yeah.
Okay, explain that to us. What is it?
So a lot of my friends are super fortunate because I'm their person, right?
Yes,
I'm the nurse. I've been around, I've worked kind of the gamut of things. So I'm the person that they call when they're like, I don't know where to go.
Yeah.
We found out that, especially during the pandemic, a lot of people don't have their nurse person. So the Covenant Care Connect hotline was kind of born. It's the place where you have access to nurses and you can help talk through some of those things. You're not sure where to go, or you just want to double check, is that really an urgent care issue? They're there for you. Like 6 o'clock in the morning to 6 o'clock at night can help answer those questions. And so it's kind of a way for everybody to have a nurse in their back pocket.
Yeah, so everyone has you now.
Yeah,
we all have a
everybody
personal
has
friend
me.
like you.
Yeah.
Okay, perfect. So to just reiterate, urgent care visits are not replacements for your primary care physician. Is that right?
That's right.
Okay.
Remember, your primary care doctor is kind of that captain of the ship for you.
Yeah.
They keep an eye on everything. They're making sure that your annual visits have the blood work that they need, that you have the tests that you need. And again, they're the ones that know your family history, know all the medications. They're truly the ones that are overlooking everything for you.
Okay.
So when you come to us at urgent care, we're focused on what's going on right now and the thing that you're complaining about. We're not there to kind of look at the whole bigger picture all the time.
Yeah.
So having a great relationship with your family doctor is really important.
Oh, you really broke that down for us. Anything else that you'd want to let viewers know that we haven't covered that you think is really important about emergency or urgent care, or just not hesitating when there is something wrong?
Right. That would be my biggest thing. If you have a question, ask.
Yeah.
If you don't have a nurse friend, call Covenant Care Connect and ask. If you're not sure where to go, ask. And again, nobody's going to fault you for coming in to any of those locations. We would much rather see you and tell you that everything's going to be okay than to talk to your family and tell you that you should have came in a day earlier. So
I love it. Everyone now has your own personal nurse. That is perfect. Thank you so much for coming in today. We appreciate it.
not a problem.
If you'd like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.